I'm Sam. I'm a student HCA. I'm going to be assisting with medication delivery. This is my ID. Student number is 414867. So, first things first, I will be providing hand hygiene. So I'll apply hand hygiene, wash my hands. This is my working station. Over there is Mrs. Ethel, my client for today. Okay, so I will check the care plan. So I will verify with the RN, LPN, and RPN to verify prescription. Prescription is verified. I will ensure medication is safely and promptly delivered. I will now compare the medication administration record with the care plan. So I have here Ethel Parker, Hospital 11234567 Hospital 11234567 She's a female, date of birth October 2nd, 1925. Date of birth October 2nd, 1925. And it says here on the care plan, she's got a diagnosis of late stage dementia with congestive heart failure, which is why I'll be giving her the digoxin. Directly assist with medication. Offer plenty of fluids with medication. Take pills whole. So no crushing. Right now it is 0800 on February 17th. I will do my second check for oral medication since the nurse has already done the first. So here I will compare medication with MAR. So here we got medication label, we got digoxin 0.125 milligrams, 0.125 milligrams, one tab by mouth daily. Hold if pulse is less than 60 BPM. Expiry date June 2021. June 2021. Giving this at 0800 on February 17th. Administering medication at 0800 on February 17th. So I can go ahead and get that prepared. So I'll check if the capsule or tab is compromised. I just mean observing the medication characteristics, ensuring there's no discoloration, that it is up to date, it is useful, there aren't any scrapes, any unusual signs of wear. So it looks good. Now I can go ahead and make sure that I'll document my checks will be completed following my assistance for Ethel to the medication. I will sign that they have been given. Now I can check which form the medication should be given in. This medication shall be given as whole, so no, this medication won't be poured into the cup. So now I can go ahead and do my third check for topical medication. So I will compare medication with MAR. So I'll compare the medication label with MAR. And right now, it is 0800. It says Swing cream, apply sparingly to top of right hand 2 times a day. Swing cream, apply sparingly to right hand 2 times a day. Expiry date, June 2021. Expiry date, June 2021. The time is 0800 and it is February 17th. So here I can go ahead and get my gloves, my gauze, my medications all ready to go. And I'm doing these to ensure that I have the right client, the right medication, the right dose, the right route, the right time, the right day, the right reason, the right expiry date. I'm got the right documentation, and I'm checking for allergies. So I've checked for allergies for all oral medication, and I have to follow those 9 rights also for the topical medication. Okay, now that I've done my second and third check for topical medication, I will do my third check for oral medication. So here I will verify prepared medication with MAR. So I got digoxin, 0.125 milligram, 0.125 milligram. Have a Thelparker. Take 1 tab by mouth daily. 1 tab by mouth daily. Hold if pulse is less than 60 BPM. Hold if pulse is less than 60 BPM. Expiry date is June 2021. Expiry date is June 2021. Giving this at 0800 on February 17th. Administering medication at 0800 on February 17th. So I will check his pulse, make sure that it is not less than 60 BPM. And as well as I will check the correct number of pills and the correct specified time matches exactly to the medication label. So yes, I have here all ready to go. Now I will do my third check for topical medication. I will verify prepared medication with MAR. So here I have Swing cream. I have a Thelparker. Swing cream, apply sparingly to top of right hand 2 times a day. Swing cream, apply sparingly to top of right hand 2 times a day. Expiry date June 2021. Expiry date June 2021. It is 0800 on February 17th. 0800 on February 17th. So again, for both the oral medication and topical medication, I'm ensuring I have the right client, the right medications, the right dose, the right route, the right time, the right day, the right reason, the right documentation. So once I've done my second and third check, I will then bring my medications and supplies along with MAR. Before entering client's room. So here I have my gloves, my gauze. And so now I can prepare medication before assisting. So I'll be taking the medication to the client, and now I can knock. I will first hand hygiene. Then I will talk and introduce myself to the client. Hi, Mrs. Athel. How are you today? Good. Stay warm. I'm Sam. I'm going to be your student healthcare aide, and I am new, so yeah, bear with me. And so, yes, I want to make sure that you know what I'll be doing this morning. Yes. So, I will be checking your medical bracelets to identify the correct client here. So I have Athel Parker, hospital number 112345678, hospital number 112345678, date of birth August 2nd, 1925. Date of birth August 2nd, 1925. Awesome, thank you. Is there any allergies I should know about? Oh yeah, it does say here that you are allergic to peanuts and penicillin. So I will just record this. Oh, perfect. All right. Now, I will gain her permission to administer the medications. And I will explain to her that I will be giving her digoxin, which is for her heart failure, and the topical medication, the sweet cream, as a moisturizer. All right. So, can I assist you with your hand washing today? She has already washed her hand. Okay. Is there hearing aids or glasses that I could, get for you? She looks like she's got all her essential items on already. So, okay. Now, I will just check your pulse, because since it is a heart congested medication, I need to ensure I do this step. It is vital. I check. So here we go. Okay, good. You are 82 BPM. Good. All right. Now I will position the client. So I will observe the client, position the client, so I can just go ahead and get you comfortable there. How is that? Good. Good. I will provide privacy, check the brakes if it states on the care plan. Okay, so first starters, I will make sure she is sitting up so she's able to swallow the medication. So I'll just have you sit up so it's easier for you to swallow the medication. Okay. Can I offer you some water? Okay. Or I can assist with water to mouth. Okay, good. So I will either hand her the medication or help assist her with the medication. I will hand her the water, or I can assist her with the water. Good. Awesome. Now I will make sure that I check her mouth to ensure she hasn't pocketed the medication. Miss Ethel, can I peek in there for a quick second? Looks great. So, she swallowed her medication. I will let you know that you must remain in a sitting up position for at least a half an hour. Can you do that for 30 minutes? Oh, she says no problem. Okay, good. Can I give you oral care today? Would you like to have me give your toothbrush? No? Oh, okay. She says she doesn't need mouth care. Okay. Now, I will go and report and record any observations that I've made. If she's had difficulty swallowing, maybe she has coughed up. So I have to make sure I have effective communication with Miss Athel and the healthcare team. Good. All right. Now, are you ready for your topical medication? Okay. So I will put on my gloves. I have here the sweet cream. I can either hand this to her, she can do it independently, or I can do this for her if her hands seem to be shaky. Okay, so I will put 1 to 2 millimeters on a gauze and discard it up to the receptacle. Oh, sorry. Okay, now I will put a thin layer sparingly in my hand. I will apply according to the directions. Directions state apply in a long stroke downward to her right hand towards the direction of the hair. Right, perfect. So, it looks like you're all good to go. I will go ahead and take off my gloves using proper hand hygiene. I will remove it and discard it into the appropriate receptacle. So, again, I can give Miss Athel some pointers here to better help her with swallowing her medication, ensuring that she's comfortable during the assistance with medication. Okay, so looks like I will toss any of my supplies in the garbage. I could have worn gloves to do the capsule. The sweet cream. Okay, Miss Athel, I'm going to go and record that I have given you these medications, so I'll check those off for you, and I will be back in half an hour to check up on you. Is there anything I can do for you? Anything that you need? Okay. Awesome. Okay, so I will make sure that I have position Miss Athel into a comfortable position before I go. I've made sure that I've recorded my observations, such as if she's been coughing, if she's been having trouble swallowing the medication. And my 3 observations that I made today is that she did have a rash on her hand. She also had difficulty swallowing, and she was coughing quite the large amount of mucus or sputum, and so I will just record it, and I will then document on MAR. What I will document also on MAR is the time that I've given her the medication, which was 0800 for both digoxin and the topical medication, Swing Cream. So I will sign it. I will also initial for my at the bottom of the MAR chart, and I will print my name. So here I've checked those off, and I've given her those. And again, I will perform hand hygiene because that is vital when working before assisting with any procedure. All right, well, thanks for watching, and I will just end the video.